Good morning. As you all enter, please write your name and your organization, in addition to something that made you smile in the chat box. Good morning, Carmela. Good morning, David. Good morning, Patty. Welcome. And happy Friday, everyone. We will be starting in 5 minutes. We'll just give some additional participants some time to join. Okay, I see Carmela from Valley Children's Healthcare said her puppy made her smile this week. That's really awesome. I also have a dog that usually does some interesting things to make me smile. And Lexi from Kings United Way said her husband. That is wonderful. If any other participants would like to share your name, your organization, and what made you smile this week.
I'm Patty Haver, Research Development Specialist at Cahuilla Delta. And what made me smile this week is the fact that, we didn't get the grant for the ACEs awareness the last cycle, but I want to appreciate and give a shout out to George because I was a little concerned about the proposal, but we had another opportunity and his advice was absolutely wonderful and it fits this application. So thank you.
Well, thank you so much, Patty. I really appreciate that. Yeah, we are here to support all of our members and to support in any way that we can, whether it's through helping out, providing information, and providing ongoing support for the efforts that you're doing, or if it's just to have a quick conversation around ACEs and how we can move this needle forward. So, but thank you for the shout out. I really appreciate it, Patty.
And thank you for your continuous support, Patty. We truly appreciate having you present at all our peer-to-peer sessions. You're a key member and we truly appreciate that. Okay, then we have Kane from Fresno Unified. Watching a video of babies and laughing nonstop has made her smile this week. That is wonderful. And to add to that, for this week, what always makes me smile is my son, who is also in this room with me here right now. So for all the mommies, during this COVID work from home season, you truly understand how the laughter of it all can be. And we'll just give it a couple more minutes here and then we will get started. Okay, I think we can go ahead and get started. Welcome everyone to ACEs Aware Kings County Peer-to-Peer Coffee and Connections Best Practice and Solution Roundtable. We truly appreciate you for being present here today and we look forward to learning with you. Next slide, please. Next slide, please, Carissa. Thank you. For today's agenda, we will be covering our welcome. Welcome everyone. And we will transfer over to introducing our keynote speaker. And we will proceed with round robin discussions with everyone in this room. And then we'll provide some 2-on-1 resources that are related to the topic discussed today. And then we'll end our session approximately at 8:10 a.m. after our raffle. Our raffle will be held at the end of this meeting. So we're hoping that you can stay to the very end so you can receive a raffle. You have to be present in order to claim your gifts. So we hope that you can stay to the very end with that. Next slide, please. All right, please note the following housekeeping slides. Please be aware that this session is recorded. The slides will be made available to you at the conclusion of our training event. Please keep your microphone on mute until we begin taking questions. If you're having any issues with connecting to this webinar, please call in and mute your phone. Please introduce yourselves in the chat feature with your name, health organization, and something that made you smile this week. Lastly, please check your Zoom name and ensure it's correct name to identify you. Next slide, please. My name is Linda Baggio. I am the program manager for ACEs Aware Kings collaboration through California Health Collaborative. And I would like you to know that ACEs Aware Kings collaboration with the funding from ACEs Aware Initiative is a collaboration of California Health Collaborative, Kings County Department of Public Health, Kings Partnership for Prevention, and Kings United Way. We very much appreciate the work of all our partners who are committed to moving this work forward to improve the health and well-being of individuals, families, and communities in which we live. And we will just give a moment I'll introduce our partners who are present today. If you could just say your quick name and we can move on to the next slide.
Thank you, Linda. I'll start off. My name is George Yagatic. I'm the Training and Engagement Coordinator Facilitator at the California Health Collaborative.
Good morning, everybody. My name is Erica Lopez, and I am the 211 Coordinator at Kings United Way.
Good morning, everyone. My name is Cameron Jones. I am the Communications Coordinator for King's Partnership for Prevention.
And Lexi?
Good morning, everyone. My name is Lexi Terrell. I am the Community Engagement Manager with Kings United Way.
Thank you. And next slide, please. Thank you. ACEs Aware mission, we've set a mission to change lives, to change and save lives by helping providers understand the importance of screening for ACEs and training providers to respond with trauma-informed care to mitigate the health impacts of toxic stress. You all being here today will help us move this bold goal and help change our community and enhancing the topic of toxic stress and acknowledging the impact that it has on our community and helping to mitigate the impact. Next slide, please. And now I will turn this over to our wonderful speaker, Carissa Luckett, who is a registered nurse from Texas, who will be our keynote speaker for today's event.
Good morning, everyone. It's a real pleasure to be with you today. We have had a polar vortex invade Texas, and so we are experiencing 10 days of weather where it has below the freezing mark. So lots of fun here in Dallas, expecting some snow a little bit later. It is a pleasure to be with you. I have been working with the Center for Youth Wellness in San Francisco in the Bay Area since 2006 and have had the pleasure of training providers across the country to screen and implement an ACEs best practice intervention in their practices. And today we're going to be talking a little bit about how to respond to patients and families after they've screened positive and how to work with them to meet meaningful goals and set meaningful goals. We'll be going through some scripted phrases that you can use when communicating with patients. But the overall training objectives will be to have a brief, very brief review of the ACEs science, and then really to talk about some of those conversation starters related to trauma and ACEs. And then we'll be reviewing Maslow's hierarchy of needs and Prochaska's readiness to change model, to see how we can incorporate those concepts while talking to patients and families about ACEs and trauma. We'll also discuss motivational interviewing techniques, and then I'm going to provide some patient assessment and communication examples for us to work through. So helping patients to get to the right resources at the right time is sort of the overall concept about what we'll talk about today. Again, the Center for Youth Wellness was founded in 2012 by California's first and our current Surgeon General, Dr. Nadine Burke-Harris. It's been an honor to work with Dr. Burke-Harris and really see her vision, which has been to lead the conversation around addressing ACEs and toxic stress through screening, interventions, and most importantly, building resilience. The Center for Youth Wellness also partners with the Bayview Child Health Center to provide direct mental health care, also multifaceted programming like biofeedback, as well as psychological counseling. And then our newest endeavor really has been to build an ecosystem model with community partners in mind that patient family at the center of our care model, as they always should be, but really to think about them not only in the context of their home, but to think about them in the context of their community and to provide supports that help build healing throughout the community. And so we offer up this ecosystem model as our current strategy to work with community partners, as well as clinical providers to further ACEs science and care. So let's talk a few minutes and have a quick reviewer about the 10 categories of adverse childhood experiences, which were originally identified in the Folletti and Onda study several years ago. So when we talk about ACEs, the core 10 are abuse, physical, emotional, and sexual, neglect, both physical and emotional, and then household challenges like mental illness, partner violence, parental separation or divorce, substance abuse, and incarceration. And we know that those 10 ACEs are critical and really were the fruits or the labor identified in that original study. But now, even in our PEARLS screening tool that is recommended for use by the OSG for screening in pediatrics across the state of California, we see an additional set of 7 adversities at the bottom or on the back page of the PEARLS tool that really look at more community issues like discrimination, deportation, things like that. And so we really need to think about the pair of ACEs, if you will, things that people experience individually, and then things that people experience at the community level. Of course, this study that brings this beautiful concept to light by Dr. Ellis was produced in 2017. And so we know now we have an additional community ACE that we're all experiencing, and that is, of course, the COVID pandemic. And it affects individuals, as you well know, in many ways, but it is a chronic stressor. And so we do need to think about that in the context of our discussions throughout this presentation and through the coming months. Just a brief reminder that ACEs are common. Nearly half of children have at least one ACE. And if you add on that pandemic right now, that means half of children have two ACEs. Now, all of the groundbreaking studies and literature around increases in death results at 4 or more ACEs. So we know that the odds ratios for the top 10 leading causes of death in the US, of those 10, 7 are directly linked to ACEs. And when you have the presence of 4 more ACEs, for instance, you are 2 times more likely to die of heart disease, 11 times more likely to die from Alzheimer's, and 30 times more likely to die from suicide. I think these numbers are staggering and disturbing, and so it's critically important that we intervene and help patient families to build resilience in spite of their adversities so that they can overcome these odds. We do know that without intervention, there can be a 20-year difference in life expectancy. So all that much more important to talk about ways to engage families around this concept. Dr. O and colleagues in 2016 really made a critical link in adverse childhood experiences and how they change the progression of development in children through the lifespan. And so when we see significant ACEs without intervention in early childhood, we see growth delay, cognitive delay, and sleep disruption in early childhood may manifest as asthma or learning difficulties. And in the teen and adolescent years, we may see obesity, violence, smoking, and teen pregnancy. Now, we know that not all stress is bad. I'm sure all of you remember much of this type of discussion in psychology or anatomy and physiology in college or high school. So positive stress can and does create a physiological response. So your brain may tell your body to dump glucose into your bloodstream so that you can focus for a test or a game, a playoff game in high school. But this is a brief activation of the stress response, and homeostasis occurs rather quickly. So your body gets back on track and goes back to a normal coping fairly quickly. With tolerable stress, there's an adaptive response, but it's time limited. So during a court hearing or immigration or a natural disaster, say a tornado comes to your town and many people are displaced and homes are destroyed, the homeostasis and recovery is activated mostly through the buffering of caring adults and interventions, so support around you. Again, this is a time-limited activation, but you can see that there is an end coming in sight, and so it does not have lasting changes on the body, if you will. Toxic stress, again, is a maladaptive response to intense and sustained stressors. So there's a prolonged activation of the stress response. And eventually, halitosis establishes a chronic stress response. So the inflammation and cascade of hormones is so prolonged that it can have very lasting changes if resilience and toxic stress regulation is not achieved. We know that there are 7 strategies that help to regulate toxic stress, and the Office of the Surgeon General calls these stress busters, and they include supportive relationships, quality sleep, balanced nutrition, physical activity, mindfulness, access to nature, and then attuning to your own mental health and mental health care. This is one of my favorite slides, and this comes from the Alberta Family Wellness Program in Canada. I think it's very meaningful to consider and ponder, if you will, for a moment, how everyone's experience is different. And so that's one of the unique things we encounter with adverse childhood experiences. Negative experiences can be um, outweighed by positive supports and some of those stress busters, but the individuality comes into play when you look at the fulcrum in this diagram with the DNA represented there. Genetically, some of us are naturally more resilient and others are less resilient. And so this is where that individual's perspective of their experiences and adversity comes into play. And it also gives us, once we understand and know that about people, it gives us an opportunity to really approach and problem solve around adversity from a strengths-based perspective. So just some key concepts when talking to patients and families about ACEs and toxic stress. Normalizing this. ACEs are common. Simplifying how we link adverse experiences and toxic stress to those changes in health outcomes long term. So saying things like, the more ACEs you have, the higher chance you have for experiencing toxic stress. And I'm just going to follow up with the last bullet. If when talking to families, it's an easy way to make the link to then pause for a moment and say, and toxic stress can bring illness both physically and mentally. So important to think about just for all of us that ACEs accumulate over time. So unfortunately, as we go through life and have more experiences, there's the possibility that your ACEs will go up over time. It's impossible, however, for them to go down over time. So we can't unexperience something. So that is why keeping a constant focus on building resilience is so critically important. And again, ACEs without protective factors at key developmental ages can increase the risk of toxic stress. Now, we're going to talk a little bit about some theories. I'm sorry, my little ducky there has fallen asleep. If you will, we're going to go back to some of those theories from psychology that you probably are very familiar with, but I want you to think about them in a new light today as we talk about toxic stress and even Maslow's hierarchy of needs. I'm sure this brings you way back to high school. So when you're thinking about families who may have a score of 4 or 5 on their Pearls tool, just engaging with that family about what's going on and maybe what you can help them with that day. If one of their needs is addiction care because they have a family member that's using drugs or abusing alcohol in the home, and they don't have secure shelter, of course, the need that's should be addressed in that moment is probably the shelter, because once the physiological needs are met, you can certainly work on more of the safety and security and love and belonging needs in that physical environment and in that family's household. Again, the most important thing would be to let the family drive this, but sometimes families can lose focus and focus on the issues that feel the most long term and challenging to address. And so a family may really be focusing on someone else's drug use when what they need to walk out of that day with is a good, safe place to stay. And so when you're matching the right resources to the right need, you need to think about these types of things. Basic needs are often met with these tangible resources that many of us have, like a food voucher or a bus card. And then psychological needs are often met by services. So a social work consult or a psychology consult. So really thinking about how, again, these resources can be broken down into a basic need that's tangible or a psychological need that needs to be met with services. If we take this a step further, we can talk about and incorporate the theory of Prochaska's readiness to change, or the readiness to change ruler. And so as we are families, you may think, well, what does readiness to change have to do with adversity? Many times we're actually asking patient families to engage with us to solve the problem of toxic stress in their life. So changing how not only you react to that, but the steps you take to buffer or build resilience does require always some changes. And so again, it's critically important to think about how you would activate that in a family's life. So let's think and talk about a little bit of this model. When patients or families are unaware of the problem, and this will likely be most times when first come to your office and they've taken the PEARLS assessment, you are then helping to provide information around the link between adversity, toxic stress, and changes in healthcare or health outcomes, excuse me. So you're going to be likely engaging a patient family at the pre-contemplation state. And so it's okay if in that encounter they walk away and they may not be ready to engage with you on changes. The next time they come back in, you can talk to them about how they're doing, or if they've seen any um, physical manifestations of toxic stress. You may be able to do that in the initial patient visit, and that's why at the Center for Youth Wellness, we strongly encourage screening only in a clinical setting where it can be done in conjunction with an assessment of the symptoms or medical issues that are correlated with toxic stress. You can get more information about those at the CYW website. And so often if you can link those with the ACE score, the physical manifestations, you may move patient families into the contemplation area where they become aware of the problem and have a desire to change their behavior to decrease those physical manifestations. Again, the next level would be preparation, and that would be where the patient family intends, or the individual intends to take action, and then maintenance. Again, a wonderful model from Prochaska. As we think about incorporating motivational interviewing into the concept of adversity and toxic stress, I think it's important to remember the original sort of concepts on why motivational interviewing was so important. And I love this quote by Miller and Rolnick, that motivational interviewing is a collaborative conversational style. And it's really for identifying a person's strengths and their own motivation so they can commit to change. Again, it's basically meeting patients where they are. And so from motivational interviewing, we have this wonderful framework called the OARS framework. And so that really talks about, the O is for open-ended questions. I'm sure many of you are aware or have had extensive training on motivational interviewing using open-ended questions. Again, this allows the patient to reflect and elaborate on any questions we give them instead of answering yes and no. Anything we can do to make sure the patient does most of the talking is important. And the purpose for this is to establish a safe environment. Again, this reflects a trauma-informed care setting. It allows you to clarify, gain understanding. Using affirmations can recognize and reinforce things that the patient may have done during previous stressful times or adversity. And so you can really make a positive statement about what they've already done. So building on that strengths perspective, it also builds rapport. It makes the patient feel connected so that you again can work towards setting mutual goals. Reflective listening is important. And you know, I know that in practices you are very, very busy. And so I'm sure there's a moment where you look at something like this or hear me talking about using this framework. You may not use all of these in one session. And this motivation interviewing framework take place in the course of 5 minutes or 2 minutes. But, you know, these are some practices that you can incorporate regularly in your visit strategies to build rapport and again help to meet mutual needs with the patient. So reflective listening is mirroring what the patient says, making sure you understand their sentiments and thoughts, and then again summarizing. This helps with retention of goals that you may have set, and it is a really important thought and concept in motivational interviewing. So I'd like to take a couple moments and just practice. I love this cartoon by Damon, where the rock, paper, and the scissors all meet up. So it is awkward sometimes just talking about ACEs and bringing the concept up. So I'd like to just give you some examples that we use at the Center for Youth Wellness. We have multiple handouts and patient education materials around ACEs. There are some great resources available at ACEs Aware on their website, and so you could use those as well. But when I encounter a patient family or I'm working with a patient family and I'm just starting the conversation about adverse childhood experiences, this may be even before they've filled out the PEARLS tool. I may be walking the patient back from the waiting room and handing them this patient education handout about what are ACEs with the PEARLS tool beneath that. And so as I said, like, we have this questionnaire we'd like you to fill out. It's about ACEs. When I first heard about ACEs, I didn't understand what they were. We always have to have a fancy name for something in the medical field, don't we? So interjecting some humor and then saying, so ACEs stands for adverse childhood experiences, but they're really just difficult or stressful times in our lives. And this sheet gives you some examples of them, and you can even point to that. Talking further about toxic stress, you might say something like, having a lot of stress over a long time can make people sick. Say you're the provider and you've just gotten a PEARLS tool handed to you and the family's indicated that the patient has a score of 4. So you're talking to them about toxic stress. You're trying to help bridge or make the connection between these number of ACEs and how that can make you sick. This might be particularly important if this patient has come in for their physical, but the mom indicates that the child is having a really hard time getting their asthma under control, and that it seems to get worse at school or when they have a test. So you can say something like, do you think that this could be happening in your family? And then again, using I think one of the most important therapeutic and communication tools that you can use is the pregnant pause. So just to say something like, do you think this could be happening in your family? And just pause there and then say, we want to help. And that gives the patient family the opportunity to engage with you or not, but that they have the understanding that you are concerned about them and do want to help them. So we're going to talk a little bit more about conversation starters when a patient has a positive ACE score. If you are utilizing the Office of the Surgeon General's scoring algorithm for screening, any score of 4 or more would be considered a positive ACE score. I put that in quotes. And so you may say something like, when you filled out this questionnaire, you mark that you've been through some difficult things. Again, use that pregnant pause there. Many people in our community have been through a lot. And if you feel like it's okay, you can say something about that. Like with the pandemic, people are losing jobs, and we see that a lot right now. It's very stressful. Can you tell me what is causing your family stress so that I know how I can help you best? Saying something like that, or what is the most important thing that I can help you with today? And so I'd like to open it up to the group and ask, either put in the chat box or you can unmute yourself and make a quick comment. What are some other ways that you've opened up the conversation around ACEs or toxic stress?
And Carissa, we have a question in our chat box. Are these handouts available online through CYW?
Yes, they are. They are available through our stress health page, which is a great question. Is currently being migrated over from its old individual web domain into the CYW website. And so if they're not there right now, they will be in the coming weeks.
Is there a website that I can put in the chat to indicate where people can go?
Oh, sure. CYW.org.
Great. I'll pop that in.
Thank you.
Great. Yeah, Carmela Sosa speaks up and on the chat and says that she doesn't currently see them on the current site, cyw.org.
So I'm actually looking at centerforyouthwellness.org. So I'll just wait for them to be ported over.
Great, thank you. And yes, the handouts are available in Spanish. And I do have a set of patient handouts that go over all of the stress busters that I can share with you all after the call. I'll share with George. I have them in English and Spanish, and they are publicly available, so I'll make sure that you all have those. Any other thoughts on how you engage with patient families? What conversation starters?
Quick question. Can you explain a little bit more? When might be the best time to initiate these conversation starters? Prior to doing the ACE and the Pearl screening tool, in the middle, at the end, when you first see the patient? When would you bring this up?
That's a great question. So at the Center for Youth Wellness, we have helped over 1,000 providers implement screening in their offices. And what we've identified as the best practice is to make sure that everyone in the office is involved in the screening process. So if you're going to hand out the screener, the Pearls tool at the front desk, which can be challenging, that you make sure that your front desk staff are comfortable explaining how to fill out the tool, because filling it out correctly is critically important. If you're using the de-identified tool, and we recommend that, and when I say de-identified, I mean that there's a box for the top 10 ACEs, those core ACEs, and we just ask the family members to put the number of ACEs they've experienced instead of answering yes or no to each of the questions. We find when we do that, patient families tend to only write zeros. So helping them have a little bit of anonymity about what particular ACEs they're experiencing is more helpful in getting an accurate result. So having the front desk or the medical assistant have enough knowledge to talk about and say, you know, ACEs are adverse experiences, and to talk about that as they're handing the tool out. And then for the provider to be comfortable reviewing the results and engaging with the family and providing some anticipatory guidance on what are ACEs and the link to toxic stress. And then whatever staff that's going to come back in and maybe do some patient education, that they feel comfortable talking about what ACEs are and the link to toxic stress as well. So throughout the visit, and you know, the OSG and ACEs Aware have recommendations on when is the best time to do the screening, and we certainly would agree and think that at the well child visit is the optimal time. But you know, it can be used at any time, at any visit, if the provider feels like it's critically important to the reason why the patient's there. I'm going to move on just a little bit so that I get through some of these last slides, and we'll have time for more questions at the end. I think it's really important to for providers, and I know this is hard for us because when we do any type of screening, we want to address it and make an intervention and resolve that issue if possible and move on. Talking about ACEs and toxic stress is something that's going to be a long-term conversation. Now, hear me when I say long-term, that doesn't mean it's going to take a long time in each visit. We know that it takes about 34 seconds to explain how to fill out the ACEs or the PEARLS tool. So it's not going to be taxing to you. You can address these issues in 2 to 5 minutes, but oftentimes patient families may not be receptive when you first start talking about ACEs because they haven't heard about it before. So it may take several well child visits with their various children over time to become familiar and comfortable with this topic, and that's okay. Every time you talk to a patient family about ACEs, I like to think of it as planting a seed. And then every time you talk to them about it afterwards, that's watering that seed. And eventually they will open up and be ready to address any issues that they have, or they won't. And that's okay too, because those are the patient family choice. And so I think it's important to utilize your time and investment in families that are ready to change, and again, keep watering and planting those seeds with those patients that may not be ready to change. Don't be afraid to ask what is the most thing that you can help the patient with at that moment. Be careful about giving advice. Do it only with permission. You know, try to remember to use your ORs. If you find that there's a lot of yes and no answers in your visit, and I know some of those need to occur, but if all of your patient interactions include yes and no answers from the patient, it might be time to work on using more open-ended questions. And I think this is critical. when you, if you think about summarizing your visit, if for those of you that have Epic or NextGen, there are great after visit summaries. And so even if you can have that printed out and highlight what you've talked about with the patient family, giving them something in writing makes them 5 times more likely to follow through. So if you guys have talked about ACEs and they think there is some toxic stress occurring in their family and they really want to work on sleep, and you have a handout on that, which you will after today, because I'm going to send those to you in English and in Spanish. Maybe highlight or just write on the after visit summary to the side, you know, good sleep, working on good sleep, and circle that. That helps to reinforce the concept of your interaction there. Again, thinking about a um, a trauma-informed organization, remember that sometimes these conversations can trigger us. And so make sure that you have this awareness, balance, connection. If you've had a difficult day in your office, maybe with patients, or there was something uncovered in your visit that was traumatic for you and the patient, have a quick debrief at the end of the day, and keep in mind that you can always access your employee assistance program. I know that Erica has a few thoughts to share with us about 211 and accessing resources. So again, those tangible resources we talked about, that'll be really the most common need that patients have. And we've noticed that in our work with other practices. And so I want to turn it over to her.
Sure. So good morning, everybody. Can we go to the next slide, please? Good morning, everybody. My name is Erica Lopez. I am the 211 coordinator at Kings United Way. Here we have a picture of Nanette Villarreal, Executive Director at Kings United Way. And we were overseeing the Community Information Exchange. We now have Alexis Terrell, which is the Community Engagement Manager for Kings United Way. Next slide, please. So I'm here to talk to you about 211 Kings County, which is a directory of resources, as well as an exciting upcoming project we're almost ready to go live with, which is the Community Information Exchange. So it is important to be able to connect patients and their families to needed services, as Carissa had mentioned. So whether it's using 211 Kings County, which is a free 24/7 service that gives you access to community health and social services, or being part of the Community Information Exchange, which is a platform that allows you as a provider to make referrals, as well as using the platform, and allows you as a provider to foster collaboration across networks to improve health and wellness for individuals and populations by moving towards person-centered care, right? So that allows interventions and interactions across healthcare and human services. So in this slide, it does show you all the different ways to access 211. If we can go to the previous slide, please, Carissa. The first way to access 211 is when you call 211, it is available 24/7. You get connected to a call specialist. They can provide information on local agencies, providing services either over the phone, or can also send the information over to you through text. When calling 211, follow-ups are offered to ensure that the caller was able to access services and provide additional resources if needed at the time during the follow-up. You can also text your zip code to 898-211, where a call specialist can provide information on resources as well. And you can also search information on our database in both English and Spanish by visiting 211kingscounty.org. And we'll be going into 211kingscounty.org in the next slide. If you're unable to find a resource, you can also chat with the live call specialist. We also have a mobile app called 211 IntelliFull, also available in English and Spanish. Very similar to the website, but display different categories such as housing, mental health, food services, and much more that can help guide you to information on programs in the database. So we do have 211 Kings County handouts available in both English and in Spanish. So if you're interested in those, please let me know after the session, and I'd be more than happy to gather your information and provide 211 handouts. Next slide, please. So through 211 Kings County, patients can be connected to resources to help reduce toxic stress and connect to categories that can help find resources to support social needs. So here is a helpful slide of categories that can be found on 211kingscounty.org. In addition to that, you can also find resources such as physical activity resources under our health category, nutrition education resources under the food category, as well as, parent support groups in our family category and much more. In the next slide, there is a short video on how you can access our 211 Kings County website and these categories. And if you're interested in learning more, or if there's more categories or resources I can help guide you to, I'd be more than happy to set up a call after this and go over the website.
Erica, do you want me to launch the video?
Yes, please.
Okay.
211kingscounty.org and get information on resources available in the community. You can search for resources in our search by text. You can also chat with a live call specialist. Search through our category menu. Click on the category of your choice. Information on services in our database are available in both English and in Spanish. Get information on a service such as description, phone numbers, location, hours, and program delivery. Thank you, Carissa. So as mentioned in the video, if you are looking for resources, you can search through our categories. We also have search by text available. So if you're looking for support groups, counseling for patients, you can use a search by text. And as well as I mentioned earlier, you can also speak to a live call specialist through live chat. Next slide, please.
Erica, give me just a moment. If you want to continue, I'll get back to that in just a second.
Worries. No worries. So next,
Erica, let me go ahead and I'm going to take control of the screen. Carissa, I've got that for you.
Thank you, George and Carissa. So as I had mentioned earlier, next we will be going into the Community Information Exchange. Kings United Way has partnered with Unite Us to establish a Community Information Exchange for Kings County. So what is a Community Information Exchange? The Community Information Exchange is a community-wide referral system that facilitates connections across multiple agencies and links patients and their families to needed services. In this slide, it gives you the core components of a CIE, which include network partners, shared language, resource database, and bidirectional referrals, technology platform, and data integration. These core components allow network partners to work together as well as share information on client records with client's consent, as well as access resources and make closed loop referrals. Next slide, please. So in this slide, we do have some upcoming Unite Us presentations. If you're interested in learning more about the Community Information Exchange and the Unite Us platform technology platform, are the upcoming sessions available. I will include the link in the chat box. But if these sessions don't work for you, please feel free to reach out to Kendra or Lexi, and they'd be more than happy to schedule a session that works best for you and your organization. I will be including their emails and the link to log on to one of these sessions, and I will include that in the chat. Thank you so much.
Thank you, Erica. A couple announcements before we wrap it up. We are getting close to our ending time. Kings County ACEs Aware Trauma Informed Network of Care has been awarded a planning grant award, and we are very excited to be receiving this award. The California Health Collaborative, in partnership with Kings United Way, Adventist ARIA Family Healthcare Network, and Evaluation Management Training, has been awarded $299,500 Trauma Informed Network of Care Planning Grant as part of our application to the statewide ACEs Aware Initiative. The ACEs Aware Initiative, it will allow for expansion of our current network efforts. And we invite you all here who are here today to be a part of our provider presence for establishing a robust and effective system for responding to ACEs screening and mitigating the toxic stress response in our Central Valley community. So it's an exciting grant, and you should all be keeping your feelers out there to see how our network will be rolled out in this planning grant. Finally, we ask that you today, at the end of this session, take our survey. Very important. We get feedback from this. I'm going to go ahead and put this in the chat box, and it takes less than 5 minutes, about the amount of time it takes to do an ACEs screening, to do our evaluation survey. We very much appreciate if you can do the survey, and it's very important to us to get the feedback that we need for each and every one of our provider engagement sessions. Finally, we've got save the dates for our upcoming peer-to-peer sessions. Our peer-to-peer sessions are held monthly on the second Friday of each month from 7 to 8 a.m. The next one will be March 12th. We are looking forward to that event on the 12th. And after that, it's April 9th, May 11th, May 14th, and June 11th. And
If I may, this is Patty Havard. Tulare County is one of the poorest counties in Central Valley, and we have 71% of pass rate, high school pass rate for migrant worker or migrant students. And I'm sorry, 71% of our schools are Title I, and a high school pass rate for migrant students are only 51% from high school. We're thinking about introducing ACEs at the migrant parents family meetings. I had the pleasure of working with some of my pharmacy students in the past from Fresno County doing diabetes screening, hypertension screening. But this one, we're going to be collaborating with our street medicine, which I'd like to see them engage, some of our medical residents engage in ACEs screening, as well as screening for hypertension and diabetes, et cetera, at the monthly meetings for Tulare County Migrant Education. What I found interesting, and going back to Carissa's point, is that when we first started, there were only few participants, but within a year, so many parents came back and went through the screening. So I think patience is something that I need to keep in mind, but at the same time, building that trust, especially in that subpopulation. And are there any other advice that you can give us, Carissa, for this population that really have no consistent opportunity for education? They're constantly moving and with COVID, etc.?
That's a great question, Patty. I think what's critical, if you're working with like a mobile unit like that, if you can have some similar verbiage about I think one of the most important things that groups can say is, we ask these questions because we care and we want to know how to best help you. If they can hear that over and over, even if it's a different provider, it really does establish connection and trust. Like they keep saying the same thing. We ask you about this because we care and we want to know how to help you in the best way. I think that's critically important. So scripting in this case is key.